Hi there, hope you're having a great week. Want to start something different this week. For the next 4 to 5 weeks, we're going to do video series focusing specifically on diseases that are connected to allergies and allergy problems. It's a time of year here in Oklahoma where things get warmer, temperatures get warmer, plants, grass, trees, pollen starts to become an issue for a lot of folks. And when that becomes an issue, we see all kinds of other issues flare up because of all those allergens that are out there. Everyone knows some of the most common signs of allergy issues, which is runny nose, clear runny nose, sneezing, watery eyes, things like that. But sometimes if you have other issues going on or you have other problems, those can be flared up by allergies, and especially this time of year. So we're going to talk about those for a few weeks in a row. The first one I wanted to talk about is for the folks out there that have occasional breathing problems or intermittent asthma, where maybe they don't need a medicine every day for their breathing, they don't need asthma medicines daily, but every now and then they'll need some albuterol in the form of an inhaler, or they get it in a nebulizer. Well, a lot of times this time of year, allergies can flare that up, and what you see is a bronchospasm, or basically a tightening down or a constriction of their airways, causes them to wheeze, mainly causes them to cough all the time. And people will complain of shortness of breath, not being able to get a full breath, a tightness in their chest, and a lot of times you'll recognize these symptoms because you've had them before, but sometimes it'll just come out of nowhere, hasn't been an issue for years, and all of a sudden now you're having these sensations of can't getting a full breath and coughing all the time and not really coughing anything up, but you may not be having the traditional allergy symptoms of runny nose, sneezing, and things like that. So if you have a history of breathing problems, or did as a kid, or had them intermittently, and all of a sudden now you're coming down with some of those symptoms we talked about, you need to be seen, and you need to get in. You don't have to go to an ER. You can if you want to, but you can come to a clinic like ours, or any urgent care clinic for that matter, and be seen and get that taken care of. But acute bronchospasm is one of the top things we see connected to allergies this time of year. So be aware of that if that's an issue you have, and just be on the lookout for it because it's really straightforward to fix. Have a great week, and we'll talk to you soon.